All right, initial disclosure is that Dr. Black's travel was denied at the last moment, so I'm Donald Moe, and I am happy to be able to present his data and his slide deck, for which I thank him. Previously, this was funded by DARPA, and the compound we're talking about today is not FDA approved for use in humans outside of trials. So this is related to the Biochronicity project. It's an interdisciplinary DARPA project looking at the utility of biologic clocks, potentially for the use of treatment in traumatic injury, focusing on their potential for decreasing the demand as opposed to all of our interventions in trauma, which focus on supply. Because bleeding is still the #1 cause of preventable death, both in military and civilian trauma. Battlefield mortality continues to improve, but we're still seeing late deaths due to multi-system organ dysfunction syndrome. This is shown as sort of the increased in-hospital deaths in conflict, the improved evacuation chain, use of tourniquets, and pre-hospital interventions are being successful, but it means that we're getting more patients to the hospital where we're not able to salvage them. The manifestations of multi-organ system dysfunction syndrome are evident in ARDS, acute kidney injury, and hepatic failure, as seen on this slide of hepatic death. The group of Hauser published their data on damage-associated molecular patterns. You just heard a little bit about them. Essentially, fragments of mitochondrial DNA, which are foreign to the circulation, are released following cellular injury. This endosymbiotic relationship falls apart when that DNA is seen systemically, and you get that sterile response similar to gram-negative sepsis. So how does it manifest in trauma? You get cellular injury, reactive oxygen species lead to mitochondrial damage, which gets released. The DAMPs are the circulating form that we find, leads to further cellular dysfunction, multi-system organ dysfunction, and it perpetuates itself either with no repair and death, or repair is possible and the patient is able to survive. So we investigated the creatively named LY294002, which is a non-selective phosphoinositol 3 kinase inhibitor, which will be called PI3K from now on, involved in cell migration, survival, apoptosis, and metabolism. It's metabolized by the liver, cleared by the kidney, and there's a number of these inhibitors in use, mostly in oncology trials. Its mechanism of action, arrow. You can see that it's upstream of PKT and mTOR, similar to anti-rejection drugs. Again, downstream effects of regulating metabolism, apoptosis, migration, etc. In our previously published data on the Biochronicity study, you can see a greater than 50% decrease in oxygen consumption in animals who received the drug after sustaining a trauma that I will describe shortly, as opposed to the animals that received the drug and had a temporary but not significant decrease, largely related to their inability to clear the drug and its persistence in those that experience trauma. Similarly, they produce less carbon dioxide. So the goal of this study was to examine the systemic effect on mitochondrial DNA damage and the DAMP levels relating to this drug and see if there was an association. So our model of injury, the animals received invasive monitoring in the form of carotid and IJ lines, a Swan-Ganz catheter, and an IVC catheter through which a controlled 35% by weight venous hemorrhage was performed. They then underwent 45 minutes of supraceliac aortic cross-clamp to render truncal ischemia, and then were reperfused. They then underwent a 6-hour protocolized resuscitation, having received the drug immediately prior to removal of the cross-clamp. So there were 3 arms. It's a small study. 3 sustained only that trauma, 3 received only the drug without the trauma, and a total of 10 received the drug and the trauma. Physiologic endpoints, lab endpoints, metabolic endpoints, and courtesy of the University of South Alabama, the mitochondrial DNA damage and DAMP levels were able to be sent. So baseline, the animals looked similar, and the model reliably created laboratory and physiologic endpoints consistent with hemorrhagic shock. So to detect the mitochondrial DNA within tissue, lung, liver, intestine, and kidney tissue was isolated, ground down. The DNA was isolated, restricted to fragments that were known. It was treated with BASE to expose potential breaks, and then FPG, which I will not bother to pronounce, was used to finalize those breaks and expose the true damage. They were then hybridized to a genomic probe, which highlights intact DNA. So more signal, more intact DNA, less signal, more damage, as shown with that. So you should have a stronger signal with the control, which has more intact DNA, and less with the treated broken DNA. As you can see, the only significant difference was in those animals sustaining trauma within the liver, as you have greater tissue or DNA damage seen. That trend continues through other tissues, but only reached significance in the liver. However, that's within the tissue. That response is seen with circulating DAMPs. So in order to assess that within these animals, the 6-hour serum was analyzed in a 200 base pair sequence specific to DAMPs, was amplified with PCR. You can see that in the control animals, as compared with the trauma animals, there's a significant difference. There is no significant difference between the control animals and those animals that had received the drug, consistent with lower levels of DAMPs at the completion of the model. Limitations, it's a small study, a total of 16 animals. It's pigs, not people. None of these animals survived, so they can't wake up. We can't do satisfaction surveys. No blood products were used. Those are known to carry DAMPs themselves, so they were isolated from the model to prevent confounding. And this model can't show causality between the mitochondrial DNA damage and the development of MODS. So in summary, trauma leads to the onset of MODS and significant damage to mitochondrial DNA within tissues, particularly the liver, even though there's a trend in this small study towards other tissues throughout the body. This has a corresponding release of DAMPs. And the administration of LY294002 resulted in metabolic suppression as previously described, as well as a return of circulating DAMP levels to baseline. In conclusion, this is a potential actor that we can utilize to reduce systemic inflammation following trauma. As previously described, it could potentially be used in the battlefield setting to extend the golden hour, as its potential use of creating a hibernation type state. Certainly, this is probably the second of hundreds of studies on the subject, so it's not ready for prime time, but it is exciting. Again, it summarizes the same things that I just said. Thank you for allowing us to present. I have to thank Dr. Mark Gillespie and his team down at the University of South Alabama for their expertise in mitochondrial DNA and circulating DAMPs.
Any questions? Just one question regarding your results there, where you noticed only significance in the liver. What's your proposed mechanism? Why you saw that?
So the role of the liver within the setting of trauma, it's especially stressful with the supraceliac cross-clamp, acute phase reactants, and so forth. But I think with greater numbers, we would have eventually seen significance within the other tissues. It's just particularly sensitive to damage in our model.
Did you guys look at kidney as well? Or?
Yeah, kidney, lung, intestine, and liver were all sampled.
I really was interested in your, I was more from your previous work, but the oxygen consumption and CO2 production, and just how in the three groups that you had, you have trauma and then the drug, VISA control being like no trauma. Just curious how the drug alone actually seemed to produce the same results as the trauma versus the positive effect of when it was combined with trauma.
Correct, and this is one of the reasons this is nowhere close to prime time. The only way to solubilize this drug is to put it in DMSO, which is incredibly toxic. In fact, the initial recommended dose resulted in complete hemodynamic collapse. So there was some dose finding to even get this dose to work. So hence the drug alone results in significant metabolic derangement in of itself.
I guess I think of that because, as you mentioned, a preventative use. I'm just curious, let's say somebody goes out on the battlefield, they're going to you're concerned they're going to accrue trauma. If they do, it's beneficial, but if they don't, are we actually, potentially making them worse? And as you said, that's something to obviously take a look, as well as any kind of tachyphylaxis that may be the drug. If they use multiple doses, then are they no longer going to have an effect from it?
Correct. And again, this is very early. It will be interesting to see if we're able to solubilize the drug in a more tolerable medium, and certainly its effect over time, and if the pigs wake up.